Chronic pain is a huge problem. Over 115 million people nationwide, or 1 in 3 Americans, suffer from some kind of long-term pain. It's the leading reason that people miss work. Chronic pain can come in many forms, and it accompanies several conditions, including low back pain, arthritis, cancer, migraine, fibromyalgia, and inflammatory bowel disease. These persistent pain can severely limit your ability to move around and perform day-to-day activities. Chronic pain can lead to depression and anxiety. It's hard to look on the bright side when pain just won't go away. Some experts say that chronic pain is a disease itself. The complexity of chronic pain can make it difficult to treat. Many of today's medications for chronic pain target inflammation. These drugs include aspirin, ibuprofen, COX-2 inhibitors, but if taken at high doses for a long time, these drugs can irritate your stomach and digestive system and possibly harm your kidney, and they don't work for everyone. With hard-to-treat pain, the prescription painkillers are also used, sometimes in combination with the other drugs. Prescription painkillers such as codeine, and morphine, and brand-name drugs such as Vicodin, OxyContin, and Percocet affect the process by which the brain perceives pain. If it's used improperly, it can be addictive, and increasingly high doses may be needed to keep pain in check. One thing we know is that currently available drugs therapies don't provide all the answers. Many people find that medications don't fully relieve their chronic pain, and they can experience unpleasant side effects. Evidence for several conditions suggests that mind and body approach can be helpful additions to conventional medicine for managing chronic pain. For that reason, knowledge is part of the mind education about the subject. Causes and options of treatment are very important in the process of those treatments. Over the next few episodes, we will cover different forms of chronic pain. Today, we are talking about chronic back pain as one of the most common complaints we see. It will be our pleasure to welcome Dr. Malinowski, who is pain management specialist, graduate of Ohio State, and currently practicing in Columbus, Ohio.
The spine is made up of hollow bones called vertebrae. Between vertebrae are the vertebral discs that are made of tough elastic material and act as shock absorbers. These discs can degenerate and become weak with age or due to an injury. Disc prolapse happens when the soft inner material of the vertebral disc bulges or bursts through the outer lining of cartilage and puts pressure on the spinal nerve. This irritation causes constant back pain. Prolapse discs are common in people who are involved in tasks that require a lot of twisting and turning of the back and spine. Muscle spasms also occur when the spinal nerves are irritated or damaged. Disc prolapse, medication and treatment, extended bed rest, analgesics, anti-inflammatory drugs, muscle relaxants, and surgery.
Welcome back. Today it's our concentration on pain management. As you know, this is a chronic problem and too many patients are complaining about pain, and the management of that issue is becoming a challenge to all of the physicians. And it's my pleasure to welcome today Dr. Mark Malinowski, who is specialized in pain management, and he's going to give us some more details specifically about the field which he is specialized with, related to lower back pain and chronic pain in specific. But also he is an anesthesiologist and he is very familiar with pain management, and that's what his specialty. Welcome on board.
Thank you.
Mark, we're going to start our subject by defining chronic pain. I mean, our audience probably, they don't know the difference between that, any acute pain versus chronic pain, and the management is different for sure. So can you define to us chronic pain?
Correct, yes. Chronic pain exists as, in terms of a time factor, where you'll have short-term pain, usually that lasts anywhere between 3 months and sooner. Then you have a period of time between 3 and 6 months where the pain is starting to transition to a chronic period, which we define as past 6 months in nature. And that is pain that is ongoing for more than 6 months.
Absolutely. And what is the most common causes or sources for chronic pain in general?
In general, you can have arthritis, which everybody knows a lot about. It's something that develops in the latter of the second decade in the 20s and develops over somebody's lifetime. That is one common cause of chronic pain. Other common causes of chronic pain can be disc-related pain, and that are the nature's shock absorbers in the spine. They can become out of place and create discomfort in the low back, possibly impinging on a nerve root, creating pain in the low back, hip, and leg. That would be another common cause. Or other simple causes of pain can be chronic daily headache, ongoing but stable chest-related pain. There are different kinds of pain that can be described, and they're all unpleasant sensations to the patient.
Now, the difference between the acute and chronic pain is related to the time. I mean, like the length of the time and not necessarily the severity or the etiology.
That's correct.
Okay.
Why become a foster parent?
I wanted to give back.
I wanted to help a child.
It's something that I felt called to do.
We heard about the need and we knew we could do it.
We missed having kids in the house.
Being a foster parent just fits with our family.
I'm Dean Sparks from Lucas County Children's Services asking you to become a foster parent. Call us at 419-213-3336, visit us at lucaskids.net, or find us on Facebook.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
Everyone loves their pizza. I do too. But here is a story. This one slice is 330 to 500 calories, 18 grams of fat, and 64% of your daily sodium intake. Next time, order thin crust, lots of veggie, and light on the cheese. This can make all the difference. Your heart will thank you.
Go to WTOL.com, Health Track.
Because time waits for no one.
I was diagnosed with stage 3 breast cancer. It had spread to my lymph nodes, and it was found because of the routine mammogram. I want women to know that they need to take care of themselves. They need to be very proactive and get that mammogram, because that's how I found out that I had cancer. And because of that grant, I am now able to have my yearly mammograms and to make sure that I continue to have good health, and I am so thankful for that.
Back pain is frequently caused by a bulging of the lumbar disc, which normally acts as a cushion between the bones in the lower back. Due to injury or natural aging, the disc wall or annulus can begin to degenerate, allowing the center or nucleus of the disc to expand, creating a bulge. This bulge can irritate nerves in the spine, causing pain in the lower back and legs. Through a minimally invasive procedure known as percutaneous discectomy, a tiny puncture is made into the annulus of the affected disc, and the Stryker decompressor discectomy probe is introduced. The excess nucleus material is drawn up into the decompressor, reducing the size of the bulge and relieving painful pressure from the surrounding nerves.
There are several potential causes for sciatic nerve pain, but the vast majority of cases are related to disc protrusion and/or contraction of the piriformis muscle. To give you a better idea of how disc protrusions and the piriformis muscle can cause sciatic nerve pain, let's take a look at the anatomy. This is a front view of the lower spine and pelvis, and as you can see, there are nerves that are branching off from the lower spine and also coming out from the sacral area, and these nerve branches join together to form the large sciatic nerve. This is a side view illustration of the lower spine, and it's showing a vertebra with a disc above and below. The disc above is highlighted in red to show that it is protruding and inflamed, while the disc below is just to represent a normal disc. As you can see with the normal disc, there's plenty of space around the nerve. the disc is not pressing up against it, and there's lots of room around that nerve root that is going to eventually join together with other nerves to form the sciatic nerve. As you can see with the protruding disc above, the space around the nerve is narrowed by the disc itself, and in many cases there will also be additional pressure placed on the nerve by inflammatory swelling. So you get the direct pressure of the nerve along with added pressure that's produced by swelling. Now here we see a back view of the lower spine and pelvis, and as you can see, the large sciatic nerve coming off on the left here, and coming off on the right we have it cut off here so you can see the hip capsule that's showing over here. That doesn't have anything to do with sciatica, but I wanted to let you know what that was. Alright, so now let's talk about how the piriformis muscle can affect the sciatic nerve. And the piriformis is a muscle that runs from the sacrum down to the hip joint. And in some cases it will run over the top of the sciatic nerve, as we're showing here. It is actually lying over the top of the sciatic nerve, and it can cause pressure when it lies over the top of the sciatic nerve. In some individuals, the piriformis will actually be underneath the sciatic nerve, as shown here. And usually it doesn't create too many problems in this type of orientation because it doesn't really place any pressure on the nerve. But there is one other configuration that can occur in some individuals, and that is if the sciatic nerve actually goes through the center of the piriformis muscle, as we're showing here, in which case compression or contraction of the piriformis can really create a lot of squeezing on the sciatic nerve and create a lot of symptoms when it does that. I discuss how to determine the cause of your sciatic nerve pain in detail on other videos, but for this video, let's focus on basic treatments you can use to get relief. The first method of treating sciatic nerve pain is the basic Mackenzie position as shown here. Now, the Mackenzie method is actually something that includes both diagnosis and treatment, and there are other positions that may work better for given individuals. But I recommend starting with this basic position where you're lying on your stomach, propped up on your elbows. And what this does is it places the lower spine in extension, where it essentially squeezes the back part of the disc and pushes any protruding disc material forward. This tends to get the protrusion of the disc away from the nerve and opens up space around the nerve and decreases the compression and irritation. Using this frequently during the stage of acute symptoms will tend to get the best results. And by frequently, I recommend doing it a few times every hour you're awake, and do it for about a minute at a time, and then take a break and move around in between doing the exercise. So that's the first step in managing sciatic nerve pain, to get the disc pushed away from the nerve root. As I mentioned earlier, in addition to direct pressure on the nerve from the protruding disc, there may be added pressure from inflammatory swelling. While over-the-counter or prescription anti-inflammatory medication may be helpful, one of the best ways to control inflammation is to use cold packs for about 15 minutes at a time every 2 hours. Place the cold pack on the lower spine with a thin layer of cloth between the pack and the skin to prevent frostbite, so that the cold pack covers the area at least 2 inches above and below your belt line. If you have severe diabetes or any type of impaired circulation, check with your doctor before using a cold pack. To address possible contribution from the piriformis muscle, I recommend using the piriformis stretch as shown above. Simply lie on your back, pull your knee towards your chest, and then slowly pull it towards the opposite shoulder as shown in the picture above. You should feel a pull or stretch in the lower buttock area. This may be painful initially, so be very gentle when you try it the first time. If the piriformis is involved, you may need to go very slow with the stretch. So be careful and just apply slow, steady pressure as you perform the stretch. If this seems to help, again, frequency is helpful for getting the best results as quickly as possible. So you can stretch 3-4 times an hour to get maximum relaxation of the piriformis muscle and reduction of your sciatic nerve pain.
Is your heart clock ticking?
We love French fries. G3 looks the same, but each makes a difference for your health. This large fry at a typical fast food restaurant has 500 calories and 25 grams of fat. This small fry has 230 calories and 12 grams of fat. This fry comes from the grocery stores, 160 calories and 6 grams of fat. So which do you choose? Because remember, time waits for no one.
I started to think, what shall I do next? What do I want to do for myself? Going through this cancer process. Just one day I just said, I'm going to fight this to the end. I got too much to live for, and I'm going to keep on pressing on. And I was very happy, to hear that there was help. And I know Susie G. Komen Foundation is very helpful and support you. And I was happy what they do for women.
Your specialty mainly right now, to my understanding, you are practicing lower back pain. And this is a very common problem. Can you give us some general idea how prominent is that problem in the nation?
It's very common. Estimates of multiple millions across the United States suffer from chronic low back pain as well as chronic neck pain. They tend to often go hand in hand. So it has become a widespread problem, and the demand for a practitioner to learn how to treat that problem is increasing as the population gets older.
What are the most common strategies right now to treat lower back pain?
Well, it's always important to develop a comprehensive approach to treating chronic discomfort. Chronic pain requires a chronic treatment plan. And the most important aspect of this whole plan, I have to emphasize, is patient participation. It's important and very important for a patient to be actually integrated into their own plan, to be a willing participant and help drive their treatment plan. Furthermore, a multimodal approach such as physical therapy, biofeedbacks, these types of things are important to integrate on a regular basis as part of their treatment plan. And then we move forward into things such as interventional care. Sometimes injection therapy would be warranted, and there are other advanced methods to help treat the symptoms as well.
So, if there's any place for acupuncture?
There is. There is, absolutely.
Oh, well, I always thought that there's no role for that. What about chiropractic?
Chiropractic therapy, manual manipulation is very important.
So that's real, I mean, because always the dilemma, I mean, sometimes they feel that chiropractic is just, a massage more than it's in reality a treatment. So there is a place for chiropractic in lower back pain or chronic pain, right?
That's correct.
Good. Now, after all of these elements is failed, there's some surgical approach and there is some interventional approach. Correct. Can you give us some idea about the treatment of lower back pain between surgical and interventional?
Sure. Certain patients may qualify for an aggressive operation. It depends on whether or not the patient is experiencing an urgent or threatening condition, such as a neurological deficit that may require immediate attention. Other patients may have already had surgery and they still have long-term problems in terms of pain. In these cases, we find that interventional care such as spinal cord stimulation may be helpful in the sense that what we do is take small electrical leads and we implant them into the epidural space. And what we do is we try to change the way the patient perceives the discomfort from a chronic problem to more of a pleasant sensation to help the patient recapture their life.
Now, you told me that it's the pacemaker of the low back.
Absolutely. It is the pacemaker of the spine.
And it's the same concept. I mean, there's a wire, you're going to put it inside the spinal space, to my understanding, and that will block the sensation of the pain.
It changes it out. The nerve fibers have a certain pace and a certain intensity to their transmission of the sensation to the brain. And what the stimulator does is it outpaces that sensation, so it creates a pleasant sensation that supersedes the body's natural pain transmission.
Now, from your experience, which you are doing a lot of those lately, I understand, what is the success rate? Because most of the patients, they're going to ask that question. Is it very successful, or it's average, 50-50?
Well, the most important thing is to identify the sources of pain in that patient and correctly identify a good candidate for this therapy. Success rate is very practitioner dependent as well, in that the patient has been properly, what we like to call, vetted through the procedures previous to this. This is more of an aggressive approach. Once the patient has advanced to this stage, usually there is a very high success rate, assuming that the patient is, of course, actively engaged throughout the whole process.
And what kind of follow-up require? I mean, the patient had that small, I'm going to call it pacemaker. I mean, that's what I'm used to. So after you put it in, what kind of follow-up the patient has to have?
So we initially put it in for a roughly 5 to 7 day period, excuse me. And that is also practitioner dependent. Some people do a shorter trial, other people do a longer trial. I tend to use roughly 5 to 7 days as an appropriate time. And during that period of time, the patient's asked to go ahead and live their life and see how much more function they get back once this is in place, and also how much of their activities, or what we call their activities of daily living, are regained, and their ability to get better sleep and so forth. Once we see the patient back after that 5 to 7 day trial period, then we can determine whether or not they are successful, and then we would go ahead and take them to the operating room, use a different set of wires, and of course a small power generator, and then they would have that implanted.
I'm sure some of the patients, they're going to ask, like, how long is this procedure?
The trial can take anywhere between 10 minutes or 50 minutes to 60 minutes. The implantation can take anywhere between 60 and 90 minutes.
And is it, I assume this is an approved procedure, and Medicare and insurance cover that?
Absolutely.
And if there's a patient's really, you know, with the current economic status, and we have tons of patients who doesn't have the money, I mean, average cost for the procedure if they decide to have it on their own, do we have any idea?
Aside from a patient's typical deductible, it's usually covered 100% once it's pre-approved and the proper vetting process has been taken.
And this is done as an outpatient?
It's done as an outpatient.
Wow.
Barring any side problems, it's always done as an outpatient.
Your pacemaker is easier than ours because our pacemaker, the patient has to spend the night in the hospital. Yours is much easier than us. Other than this stimulator, you know, technology always advancing on daily basis. If there's anything in the horizon we have to expect coming soon, I mean, in that kind of management, lower back pain, chronic pain?
Well, we are starting to move towards minimally invasive techniques, percutaneous fusion of the low back. Instead of major operations, the patients will have large incisions and so forth. We can start doing small posterior fixations through the skin, and smaller is usually better in these circumstances.
Sure.
There's also a movement towards endoscopic discectomy, and this is also a smaller incision in terms of what could be done from a traditional surgical approach. Spinal cord stimulation is really still on the forefront. Although it's been popularized over the last 15 or so years, we're starting to move towards other regions of the body where these are appropriate techniques as well, in the neck. And then, of course, there are other uses for the stimulators that are currently not FDA approved, but are definitely working for patients.
What about the laser? I mean, there's some question comes from the patients about lower back pain, laser treatment. Is it part of that technology?
Laser treatment was popular approximately 7 to 10 years ago. And over the last few years, it's really become something that's fallen by the wayside because of the complications that can occur by damage through the laser itself.
Now, I did my homework and I did some reading. What about stem cell?
Stem cell is also something that's on the horizon. Currently, the centers are actually in the clinical trial standpoint. I believe that there is at least one, if not two, off the top of my head, of multi-center clinical trials ongoing for stem cell implantation into the disc itself to help regenerate a deteriorated disc.
Wow, that's amazing. Thank you. That's really very lightening and at the same time very informative, and I hope all of our patients now knows everything about low back pain management, chronic pain specifically we are talking about, and really we appreciate you coming down here. It was wonderful, and thank you so much.
Thank you very much.
First, we localize the level of our incision under X-ray fluoroscopy. A 1-inch or less incision is marked on the skin, and the incision is made. A guide pin is placed through the incision down to the bone, which is checked with the X-ray machine. Over this guide pin, dilating tubes are placed, gradually increasing in size. Over the dilating tubes, we then place our working tube with a handle on it. The dilating tubes are removed. Inside the tube, we place our camera. A laminotomy is then performed. A 5mm diamond-tipped burr is inserted into the working tube. The burr is used to thin the bone for our laminotomy. Kerrison rongeurs are used to remove other pieces of bone to complete the laminotomy and smooth the round edges. Through the opening, we place our pituitary grabber, which grabs pieces of disc, which are greenish-yellow in this image. This disc is pushing on the inflamed red nerve. Once we've removed the appropriate pieces of disc, and the nerve is no longer being pinched, a laser can cauterize the edge of the disc. All operating equipment is then removed. The nerve falls back into position and is no longer being pinched by anything. Once the nerve is completely freed up, we can then remove our instruments and working tube and close our small incision.
I hope you learned enough information about managing chronic pain and the question to ask your doctor. Your family doctor is the captain of your healthcare. Join us for our next program as we continue our examination of chronic pain management. Also, send us your suggestion or questions about this show or any other topic, and join us on Facebook by visiting ToledoCardiology.com. And remember, time waits for no one.